We're still working on PowerPoint called Respiratory System Part 2. This time we're specifically talking about a process called pulmonary ventilation. It is otherwise known as inspiration or inhalation, and the exhaling process is exhalation or expiration. Okay, so let me give you some background information. This requires us to talk a bit about physics. In physics, there is a law here called Boyle's law. And you'll notice it says the changes in volume lead to changes in pressure. Changes in pressure cause air to flow into or out of the lungs. All right, so I'm going to use some of the white space here to draw a little bit of information for you. When we're talking about pressure and volume, we know that these two things are inversely proportional. Let's take a large space like this one here, and we say we're going to have a large volume in this space. I'm going to use an up arrow to indicate an increase in volume because we have a large space inside this box. Because we have a lot of room in this box, the pressure in here is going to be very low. Okay, so compare that to a smaller box or a smaller volume. I'm going to indicate this is a smaller volume by using a down arrow, and I'm going to use that to contrast against this larger box on the left. Now, if I take the same amount of air in the large box on the left and I cram it into this very small box here on the right, then the pressure of the air in that very small box is going to be increased. So I'm going to use an up arrow and a P to indicate my pressure here is increased in a smaller space or a smaller volume. So what I'm trying to illustrate to you is a couple of things. One is that pressure and volume are inversely proportional. And what that means is when one goes up, the other must go down. So if I have an increase in volume, the pressure automatically is going to decrease, and vice versa. And the second thing I'm trying to illustrate is this. We have two variables, volume, represented here by V, and pressure, represented by P, that will drive how we breathe air into and out of our lungs. Okay, so these are the concepts that we're going to carry forward now that we've kind of laid the foundation here for Boyle's law. To understand how we breathe, we need to talk about three pressures. We have atmospheric pressure, intrapulmonary pressure, and intrapleural pressure. I'm going to move you to a clean screen here, and we're going to take a look at the lungs. You may want to draw this along with me on a clean sheet of paper somewhere and stick it into your notebook. Okay, I'm going to put the trachea right here at the top. I'm going to branch down into some bronchial passageways, and then I'm going to place my lungs down below. Okay. All right, so we have a visceral pleura that is covering your lungs. I'm going to give me some room here, so I'm not going to draw it right on top of the lungs, but close enough. Okay, bring it around. I'm going to label this one as my visceral pleura. All right, and then my parietal pleura is, I'm going to exaggerate this. I'm going to draw it a bit away from the lungs. Of course, it's the outer layer there. All right, and that's our parietal pleura. Now, really close to that parietal pleura, I'm going to draw the thoracic cavity wall. And down here at the very bottom, I'm going to place the diaphragm right up underneath that. So let's label that as diaphragm. All right, now let's talk about those three pressures. Outside the body is a pressure exerted by the air around your body called atmospheric pressure. I'm going to abbreviate it as ATM for atmospheric and P for pressure. And at sea level, we're going to use this value here, 760 millimeters mercury of pressure. That's, again, assuming we are living at sea level. All right, there is another pressure that exists inside your lungs. I'm going to come all the way in here, and we're going to call this pressure our intrapulmonary pressure. Okay, intra, of course, meaning within. And then, let's see, we've got visceral pleura here and parietal pleura here. Parietal pleura is anchored to your thoracic cavity wall. Visceral pleura is anchored to the lung tissue itself, and we know that right between those two serous membrane layers, all of this in here, this is going to be serous fluid. And the pressure exerted by that fluid between those two serous membrane layers is called an intrapleural pressure. I'm going to use P again for pressure. And I should make note here that that intrapleural pressure must always remain negative or less than intrapulmonary pressure. Otherwise, the lungs will collapse. And when lungs collapse, it's kind of like squeezing a bag of potato chips. The air would be forced out of the lungs, and lung collapse is called atelectasis. Okay, so let's review. We've got three pressures. We've got atmospheric pressure, which is outside your body. It's about 760 millimeters mercury. Intrapulmonary pressure, where is that located? That's inside your lungs. And we have intrapleural pressure. That is specifically between your visceral and parietal pleura. And like we just said, that's going to always remain negative to your intrapulmonary pressure and atmospheric pressure in order to keep your lungs inflated. All right, so it looks like we're ready to now move on and talk about breathing. And in order to appreciate breathing, let's bring back in something you may have learned previously in bio class, and that is the external intercostal muscles, which is situated between each one of your ribs, and your diaphragm, which sits beneath your lungs. So down here, of course, is your diaphragm, and these muscles here are your external intercostal muscles. Now, that set of external intercostal muscles must contract, and when they contract, they will expand or enlarge the volume inside your lungs. So keep in mind here that when they expand or contract, they move the lungs larger, they increase the volume in your thoracic cavity. You may also want to notice what's happening here with your diaphragm. When it contracts, it pushes up in a dome toward your lungs, and then of course it can flatten down as well. So we're watching the contraction and relaxation of those muscles as being something that helps to drive the breathing process. All right, so here's how inhalation works. Inhalation or inspiration is an energy-intensive process. In order for you to inhale, I would like you to start by putting your hands on your rib cage, kind of like putting your hands on your hip, but just higher. Now, take a deep breath of air. What did you feel happened to your rib cage? You should have noticed that your rib cage expanded. That is, your external intercostal muscles and your diaphragm contract. When this happens, your intercostals expand the size of your thoracic cavity by flaring out. Your diaphragm pushes down toward your stomach. Upon the contraction, we've just increased the volume in your thoracic cavity. So what do you know about volume and pressure? They're inversely proportional. When one goes up, what happens to the other one? It must go down. So now intrapulmonary pressure will decrease. Now, let's go back to this thought for just a minute. If atmospheric pressure is 760 millimeters mercury, and we just decreased intrapulmonary pressure, let's take it down to something like 756 just to illustrate the point. What do you think is going to happen to air? Air flows along a gradient from high pressure to low pressure. And of course, that allows air to flow into your lungs along a pressure gradient. Okay, so keep in mind, muscles contract, volume increases in the thoracic cavity, intrapulmonary pressure decreases, and of course, air flows in. So you say, what about that intrapleural pressure? Okay, it's going to always be less than which pressure? Well, going to have to be less than atmospheric pressure, and it's going to have to be less than intrapulmonary pressure. And that's in order for your lungs to stay inflated. Now, exhalation or expiration is a passive process. That means the process requires no ATP or energy. All we need is for your muscles to relax. So notice, when your intercostal muscles relax, your diaphragm relaxes, the size of your thoracic cavity goes from an expanded state down to a more relaxed state. When this happens, we now make less room inside your lungs, volume decreases, intrapulmonary pressure increases. Let's say this time we're looking at something like 762. How does that compare to atmospheric pressure? Do you remember what atmospheric pressure was? All right, now where's your greater number? Of course, air flows from the higher pressure to the lower pressure, and so inside your lungs we have a greater pressure, Outside your body, it's less. So we have air following a pressure gradient out of the lungs. All right, so if you've ever heard the phrase sing from the diaphragm or speak from the diaphragm, that muscle is the one that's important for helping to pump air into the lungs or pull it into the lungs, kind of like a vacuum cleaner. Its relaxation is what allows air to move out of the lungs. Okay, just another view here of inspiration and expiration. So keeping track of this, you want to keep track of whether muscles are relaxing or contracting, whether or not your volume increases or decreases. Same with your pressure. Is it increasing or decreasing? And what's happening relative to the outside atmospheric pressure. Just a couple of things to keep straight here in terms of what influences pulmonary ventilation. There is airway resistance. Let's imagine a bronchial passageway for just a moment. If you have mucus or inflammation that causes a constriction of that pathway, that may restrict the flow of air that comes into your lungs. We also have alveolar surface tension. We know those alveoli are kept from sticking to one another by an oily secretion. Do you remember the name of that secretion? That secretion is called surfactant. Okay, and of course, if you have anything that influences surfactant, that may influence whether or not your lungs can stay inflated. Last, we have lung compliance, and that deals with the stretchiness of your lung tissue. So we haven't really talked about the lung tissue itself, but it is rather elastic. And just like a rubber band or elasticity in underwear, if you have poor elasticity, you have poor recoilability. So when your lungs inflate with air and expand, the process of exhalation is passive. So when your lungs return back to the normal size, you need for the lung elasticity to help snap back to force that air out of your lungs. If you have poor compliance, you have a poor elastic recoil that pushes the air out. All right, so that is inhalation and exhalation, or inspiration and expiration in a nutshell. Next, we're going to talk about control of breathing or control of respiration. So we will move this on to our next video.